MRSA, the MRSA virus. This is a term many of us have heard before, but very few people know exactly what it means. The MRSA virus can be transferred very easily between persons. It is important that every individual learn about this MRSA virus because if not treated properly or cared for in time, it can possibly become fatal. The MRSA virus was first identified in the 1960s in hospitals and in nursing homes. According to the Journal of the American Medical Association, it is important for all Americans to know about this rapid spreading disease because an estimated 19,000 people in this country have died from this antibiotic strain of staph, which is scientifically known as the methicillin-resistant Staphylococcus aureus virus, or MRSA. In order for you to be able to avoid getting this virus, it is important for you to know exactly what the MRSA virus is. The MRSA virus is a certain strain of staph that lives on the skin and in and around the nose area on the face. This staph bacteria does not become harmful until it gets into the skin or inside the body. The normal Staphylococcus aureus infection develops when staph infection gets into an open cut or wound on the body and then infects the underlying body tissues. The normal type of staph can range from being a mild case needing no treatment at all to a very serious case requiring hospitalization that could possibly lead to death. The difference in the regular type of staph and the MRSA virus is that the MRSA virus causes more damage to the body because it is not treatable by the normal antibiotics such as penicillin or methicillin. The reason this is such a big deal is because the MRSA virus is a mutating virus and it is changing all the time. So it is important to know that it will not be affected by the normal medicines. Majority of these infections show up on the skin as bumpy red rashes. However, sometimes the MRSA virus can infect the blood, lungs, eyes, and joints. The MRSA virus is not normally found in these parts of the body. However, if it is way more serious and the infection could possibly threaten your life. Now, the methicillin-resistant Staphylococcus aureus virus may be transferred in many different ways. By catching this virus, you will probably become very sick. To lower the risk of catching the MRSA virus, it is important that you are aware of all the different ways that the virus can be transferred. First, the MRSA virus can be transferred from skin-to-skin contact, having contact with open wounds or bodily fluids. Also, if an open wound touches any surface that carries the MRSA virus, you have a chance and a risk of becoming infected. Sharing things such as towels, razors, grooming tools, etc. is also something that needs to be avoided if you do not want to catch this virus. Another way that the MRSA virus can be transferred, which is very unlikely, is if your skin comes into contact with dust particles that carry the MRSA bacteria. If you have caught the methicillin-resistant Staphylococcus aureus virus, there are many different effects that it can have on your body. Some of these effects can be simple, while others can be very fatal if the virus is not treated. The main effect on the body is the red rashes that will appear on your skin. Besides the red rashes, you will also start to feel very sick and possibly weak. Once the virus has entered your body's immune system will try and fight off the virus. This causes your body to use up a lot of its energy and will leave you very exhausted. But since the virus is so strong, the body cannot defeat the virus on its own. Doctors will normally put you on antibiotics, but these antibiotics, such as methicillin and penicillin, will not always be able to defeat this virus. When trying to fight off the virus, the body will fight against the virus. Depending on how bad your case is, there is possibly a chance of you having internal organ damage. The MRSA virus gets inside the blood, and it can slowly lead to blood poisoning. This is also known as the process of sepsis. Sepsis is when the pus in the body that is infected by the MRSA virus slowly leaks down into the bloodstream. This blood that is now infected with MRSA has a very chance of giving you blood poisoning. Since it's a slow process, many people ignore the signs that they're having and think that they simply have a case of the flu. By the time that they realize that something is wrong and decide to see a doctor, it is normally too late because majority of the blood has then been infected by the MRSA, and this is what can possibly lead to death. There is still no cure or vaccine for this methicillin-resistant strain of staph. Most doctors will still keep you on the antibiotics, hoping the virus will run its course and that your body and the antibiotics together can help keep the virus from causing much damage to your body. If the virus is covering a huge part of your body or skin, there's a chance that the doctor may want to surgically remove it. This could range from being a small part of your skin to a finger to even a limb. The reason the doctor would want to possibly remove a limb is to keep the virus from spreading to the internal organs, because that is when you could have the most damage, potentially death. Another important piece of information that is not often publicized is the steps that you should take to prevent yourself from catching the MRSA virus. Now, since there is still no cure to the MRSA virus, it is not going to be 100% preventable. However, very simple things can lower your risk drastically, the main thing being good hygiene. Things such as washing your hands thoroughly and using an alcohol-based hand sanitizer can also reduce your risk of catching the virus. It is important that you keep things such as cuts and open wounds closed with sterile bandages and until they are completely healed, because an open wound is the easiest way for the MRSA virus to come inside your body. Also, if you know someone that has an open wound and you should avoid contact with their wound and the bandage that cover it. Lastly, remember that sharing personal items could exchange bodily fluids or any bacteria which could also cause the MRSA virus should be avoided, because these are the easiest ways to catch the virus. Now that you know all about this new outbreaking virus, which is the methicillin-resistant Staphylococcus aureus virus, it is important that you decide if you want to protect yourself from getting it. If you want to protect yourself, look for signs and symptoms such as the red rashes that occur on your body, and if you notice these, contact your doctor immediately. If you're not careful in protecting yourself in the early stages of the MRSA virus, it is something that could possibly take your life.